So my name is Denis Horgan. I'm the Executive Director of the European Alliance for Personalised Medicine. The European Alliance for Personalised Medicine is a multi-stakeholder platform bringing together 5 groups of stakeholders: patient organisations, medical professional organisations, payer organisations, political, as well as university. And the overarching aim of the Alliance is to reach consensus between these broad groups of stakeholders from different disease areas, from different research backgrounds, to facilitate an environment for personalised healthcare. And how can we bring this into healthcare systems? So as I outlined, EAPM is a multi-stakeholder platform, so it brings together these type of stakeholders, and we act as a bridge between stakeholders to reach consensus and then to communicate to policymakers. So the aim of EAPM's contribution to Work Package 6, which we're taking a lead in Pioneer, is to facilitate alignment between different health technology agencies, regulators, medical agencies, and how can they reach alignment in terms of evidence, in terms of how they view data, how data is collected, curated, and how they can understand data to become to different decisions. And often, different types of stakeholders are not involved in the decision-making process. So we're developing a problem statement to describe what is the state of play, and where do we want to go, and then an evidence framework, bringing together these broad groups of stakeholders. One would think in the healthcare community, everybody knows each other. And because everybody's going in the same direction, we all want to give better treatment or care to patients and citizens. And prostate cancer is specific also because you may have a prostate cancer which you don't need to treat, but treat later. So a lot of different types of stakeholders don't interact with each other. So an important development there was to form this stakeholder group, to have an interaction with groups of stakeholders to see how each are contributing to identification of a disease, how to treat a disease from a clinician perspective, how to develop new research to treat different forms of the disease, taking account of personalised healthcare, and then looking from a HTA or payer perspective, what are the evidence that they would need to make a decision. So first we had several meetings of the stakeholder forum to bring these groups together to outline what are the key aims of the work package and what is Pioneer. And then we said from a European level, so we involved UNETA and we involved European Medicine Agency so have a European-wide view and the European Commission, and then looking at different member states, seeing how the decision-making processes are done. While we can have an EU approach, healthcare is a national competence, so it's very important to have the agencies involved. So more was to set out what is the key issues, or common challenges, and how we could have certain reference points to tackle, to make decisions around how we can improve access to different types of treatments at an earlier stage or a late stage for the patient. So now we've outlined in what is a problem statement, a policy paper. So we'll communicate this to the different politicians and policymakers, both at a European level and national level. So there is key to communicate what are the challenges facing the prostate cancer community. So we will communicate what is the policy paper, what are the outcomes, and then we'll align with the key stakeholders to develop an evidence framework. What are the types of data that different types of stakeholders will need to make different decisions from a HTA perspective and from a payer perspective, and how then to take account of the different experts, whether the stakeholders, such as the clinicians and patients. The key question is prostate cancer is specific because you can have early stage prostate cancer. So the question is, what does decision makers such as payers or health technology agencies need to take into account with these type of treatments where they will have different endpoints, and what kind of evidence needs. So what we're looking to do is develop a future framework that they need to take account of, taking account where the research is being developed. Because a lot of research is focused on how we can treat patients earlier so they can have better quality of life. A lot of treatment decisions are taking into account late-stage prostate cancer. So now we're trying to develop a framework around early-stage diagnosis and what kind of decisions or frameworks different agencies need to understand around this. So it's early stages, that should be said. Each work package is finding its feet in terms of collaborating and coordinating. We've developed a problem statement now, which is a policy framework. We're going to develop the evidence framework. Now we're going to work very closely, as you just mentioned, with work package 2, 5, and 3, that contribute different elements. One is about a collection of data from different types of databases. One is about access, and one is about statistical issues around that. So now, taking account the evidence framework, we will engage with what they see as their challenges and the solutions to embed this into this evidence framework. The key aim for Work Package 6 is ambitious. We want to answer the question for the prostate cancer community how we can understand value. And understanding value in terms of value in healthcare means in terms of how we can improve access and how can we shape this and what kind of evidence can support this. So a key issue is that we bring all stakeholders together to align, to share what data they have, to develop this framework so we can communicate to policymakers, both at the European level and national level, this framework that will work to support a framework to bring this type of treatment to patients.